States and union territories are gearing up to open religious places, malls, restaurants, hotels and offices from tomorrow. The Union Health and Family Welfare Minister had on June 4 issued standard operating procedures to open up these places. As per the guidelines, generic measures need to be observed by all staff, workers or patrons at all times when visiting malls, restaurants or workplaces. These include physical distancing of at least 6 feet and use of face covers or masks. Respiratory etiquette to be strictly followed. This involves strict practice of covering one's mouth and nose while coughing, sneezing with a tissue, handkerchief, flexed elbow and disposing of used tissues properly. Self-monitoring of health by all and reporting any illness at the earliest to state and district helpline. All restaurants have been asked to ensure that takeaways are encouraged instead of dine-in. All staff and patrons to be allowed entry only if using face cover or masks. In case of religious places, the SOP advises people above 65 years of age, pregnant women, children below the age of 10 years to stay at home. Large gatherings and congregations continue to remain prohibited. And the Delhi Chief Minister Arvind Kejriwal addressed the people of Delhi today through a digital press conference. And in his address, he has announced that all restaurants, malls and places of worship will open in the national capital from tomorrow. Meanwhile, hotels and banquet halls will remain closed in Delhi. This is what the Chief Minister said. Kejriwal also informed about the opening of Delhi's borders from tomorrow. The Delhi Chief Minister advised that as a precautionary measure, the elderly people should have a minimum interaction with their family members and others, especially children, as senior citizens are the most vulnerable to COVID-19. And our correspondent Tapas Bhattacharya now joins us for the latest on this story. Well, Tapas, so from tomorrow, restaurants, malls, these places will be open, but people have to be very careful. They have to ensure that they follow the right etiquette as far as respiratory etiquettes are concerned and maintain social distance. But that's not enough as well, isn't it? It's apart from collective response, there has to also be from the malls and the restaurant side a number of guidelines that they have to follow. Fill us in with the details.
Yes, Mark, but the big news that is coming in from that particular press conference by Delhi Chief Minister Arvind Kejriwal was that from tomorrow, there will be they will bar actually people coming from NCR outside Delhi who are coming here in Delhi for getting themselves treated. So yes. Delhi hospitals, just like the RML, LNJP and other such hospitals, which comes under the direct purview of Delhi government, they will be catering only to the Delhi citizens, Delhi people. And in all likelihood, they will, this is one of the also came up with this guidelines and order, but at that time Delhi High Court actually stayed that order and said that it doesn't go in with the the principles of a constitution, as well as it doesn't work out for a state like Delhi, which has seen that it has grown into the Delhi NCR region, and that's one of the reason why they would they prefer that this kind of order doesn't come out in the future. But Delhi government keeping in mind the kind of the way the COVID cases has spiraled in the national capital, have taken the decision. It will be interesting to see how how it will be legally challenged and how people will come out. Remember, most of the even in centrally run institutes, like for that matter Maulana Azad or AIIMS or other such big hospitals, right. There is a substantial number of people coming from outside. So it will be a Herculean task to stop people from coming, from getting them treated. And if you stop if you stop them, if you bar them from coming and getting tested in such a in such a places. It doesn't amount of goodwill. Now, having said that, if you the kind of the 5-member committee the Delhi government made, the Dr. Mahesh Verma, who was leading that and was the chairman of that committee, has said that keeping in mind the trend that is currently going on in Ahmedabad, Mumbai, as well as in Chennai, it is expected that by the end of this month, by the end of June, one will find that almost 1 lakh cases is in the national capital. And now, already yesterday Delhi has seen 1,320 cases, and almost more than 27,650 cases are currently here. So keeping that thing in mind, it is expected by the Delhi government's own committee that more than 1 lakh cases will be coming in place, and one required by the end of this month, almost 15,000 beds. Remember, Delhi government is always talking about the fact that one should home quarantine themselves, and only very few people required to be admitted. But even then, more than 15,000 beds are required for patients who are who faces issues, especially when it comes to oxygen.
That's an important point you've raised, Tapas, the point of oxygen. Now, I mean, it's not only the ventilator, though those are very, very few people who require a ventilator, but quite a few people may require oxygen. So tell us about oxygen supply.
Hypoxia is one of the medical condition that comes on for the COVID-19 patients, and almost 25% of people require some sort of oxygen supply in their system because of the paucity of the oxygen during this COVID-19 syndrome. So if keeping in that mind, only 5% require ventilators, but you require more number of oxygen cylinders, more number of oxygen situations. So keeping that in mind, you need to have more than, let's say, 15,000 beds he spoke about till the time June. But one would require, according to the committee itself, 42,000 beds by 15th of July. But that is by the 1 month, by next month, 15th of July.
Tapas, so you're talking about expanding of the number of beds, but the question is about oxygen, even for the people in home quarantine. Is there any, any move that, because the Delhi government had said that they would provide oximeters to people so that they can measure whether their oxygen level falls. And if their oxygen level falls below 90, which becomes the dangerous level, then they should require some assistance. But what kind of assistance? That's the question. If the beds are full, where will they go?
That's the point, Mark, that, what you preach and what is happening on ground reality may not be the same. And that's where the problem lies. If, God forbid, if somebody gets ill and somebody has to get now Herculean tasks in a city, in a state like Delhi, which is the capital and which tends to boast of one of the best and one of the finest healthcare system. Even there, we have been getting reports from all across the city that it is a Herculean task to get anybody admitted in Delhi hospitals, especially government hospitals. Private hospitals are full; they are not taking any more patient. Obviously, not many can afford private hospital. So those who can will definitely pay and has such an insurance scheme to come and to get involved. But again, when you talk about the insurance scheme, there are a lot of insurance scheme which doesn't cover COVID-19. So that is another point. And also the fact that when you talk about government hospitals, your government hospitals are filled to the choke. So keeping all this in mind, when the government spoke about the fact that there are enough beds, but when you talk about the ground reality, that is not the case, and that is where the problem lies. And that is something that the hospitals as well as the state government, as the central government, need to ask themselves that they need to have this system in place. Obviously, they have not opened the Baratgarh as well as the hotels, and they're keeping it in as a backup option if they require to extend the facilities on those places.
Tapas Bhattacharya, thank you very much for joining us with those inputs. Moving on to our next story, the 910 Indians